And welcome. It's Friday. It's time for our regular Lunch and Learn. And today we're going to be we're going to continue to talk about thyroid brain and its effect on other areas of your health. So we started last week and we talked about the different things. We talked about hypothyroidism, we talked about hyperthyroidism, and we talked about how all of these are connected to everything else in your body. So today we're going to continue that discussion, and we may even have a part 3. It just depends on how we do here. So the article goes on to say, supporting brain health when you have Hashimoto's hypothyroidism consists primarily of taking the best thyroid hormone medication for your needs. You want to have an autoimmune diet, okay, and that's going to be an anti-inflammatory diet. And those people don't like that because all their comfort food is usually off the chart on that. All right. All of these things will lead Hashimoto's into remission, although medical people say that it can never be reversed. We've seen your ANA antibodies reverse on your blood test. So whatever that means, we've seen it happen. It doesn't happen quickly, but it can happen. So the best thyroid medication is not necessarily what you are being given by your doctor. The article says that the average doctor will prescribe a synthetic thyroxine T4 because that is typically what your insurance will cover. However, many patients feel better with a bioidentical thyroid hormone replacement that also includes T3. Others may need a thyroid medication that is free of fillers, such as cornstarch, which triggers an immune reaction in some. So in your medication, there is cornstarch. There is all kinds of different fillers that they put in there, which I don't know why they do that because it's not necessary. But on your supplements from the big box store, you'll often find that. So that's one of the things that you want to look for. Monosodium crystalline is one that is very, very often there. Magnesium stearate is another one. We don't need those things. There's nothing good in there. There's nothing, it's not going to be beneficial for you at all. But that's typically what you're going to get. So when you're managing Hashimoto's, right, you want to look at possibly managing the gut-brain interaction. We talked about this last week, so go back and review that if you missed that. But you've got a vagus nerve. It's one of your cranial nerves, right? Your cranial nerves in the back of your head. They wrap around your face. They go down your body. And the vagus nerve is your longest cranial nerve, right? The saying, what happens in Vegas stays in Vegas, is not true. Because your vagus nerve tells the brain what's going on in your gut. And if your gut is messed up, then mission control, your brain is going to be messed up as well. So food intolerances are the most common interaction, I guess, that Hashimoto's will have for you. Okay. It says, in fact, the tissue most often damaged by gluten intolerance is your brain tissue. Corn, eggs, soy, and grains are often common triggers as well. Now, as we said last week, when your body is having an immune response, when it's having an allergic response, that's because the immune system is confused and overwhelmed. I personally think that the egg is a perfect food. It is a perfect protein. I know if you're a vegetarian, you don't want to hear that, but that's my opinion. It is the perfect food. But corn is almost always a trigger because it is genetically modified. I think it's 95% of corn in the United States is genetically modified. So is soy. And so are our grains. Now, our grains are not necessarily genetically modified when you plant them in the soil, but our practice here in the United States is in the industrial farms. Whenever the grain is ready for harvester, the farmer will spray the crop twice with Roundup in order to yield more seed. So I do appreciate, I'm very conservative. Fiscally, I want to make the penny work twice as hard as it needs to. So I understand that you want to get all of your grain. You don't want to have any of it left behind. I totally get that. But what happens when they spray it with Roundup is that the Roundup gets on the grain. Roundup is a biotoxin. And in fact, Several people have won court cases that it is actually cancer causing. So we don't want to have that in our food supply. Now, I'm going to do a little bit of a digression here. Inside your small intestine, which is where you absorb all of your nutrients, you have a lot of villi. Now, villi are little hair-like structures. So you're going to pretend like my fingers are the villi. And these little hair-like structures are all through here, right? In your small intestine. All of these little hair-like structures absorb your nutrients when you eat your food. When your villi is damaged by genetically modified foods, by things that we eat that are not foods, those villi, they shrink, they go away, they disappear, and you have no surface to absorb your nutrition. So this is really, really important. Now, if you get off of grains, you get off of genetically modified foods, those villi will come back. So that's the good news. But if you have any kind of gut issues, gas, bloating, if you have a hernia, a hiatal hernia, that's going to cause some issues. If you've got SIBO, small intestine bacteria overgrowth, that's going to cause some issues. If your ileocecal valve does not close properly, that's going to cause some issues. And all of these things that we can test for if you're here in the clinic. But corn and soy and grains will trigger food intolerances and an immune response. Gut inflammation, the symptoms are acid reflux, irritable bowel, gallbladder congestion, and other ailments linked to poor gut health are common triggers for autoimmune. Now, I just want to pop in here and say that if you have acid reflux, it could be because of over acid. That's what you're thinking, because that's what your commercials are telling you. But also under acid, and the right term for that is hypochlorhydria, right? Low stomach acid also causes the exact same symptoms as over acid. So you may not have over acid. Most people don't. Most people, certainly if you're over 50, it's probably because you're not producing enough gastric acid to break down your food. So just be aware of that. Gallbladder congestion. How many of you out there have had your gallbladder removed? Probably a lot. Why is that? Because the gallbladder is a little purse. It is connected to the liver by the common bile duct, and the liver produces bile. The bile goes through the common bile duct into the gallbladder. The gallbladder holds the bile until you consume a high-fat meal or a fried food of some sort. The bile then is released into the small intestine, and it acts like soap to break down the fat. So if you like to eat a lot of fat, say cheese, avocados, milk, guacamole sauce, whatever it is a lot of fat. If you don't have any bile in your system to break down that fat, you're going to wind up wearing the fat because the molecules are just too big to go through the system. So the body pushes it into your adipose cells, and we get bigger and bigger. So the purpose of the gallbladder is that, but the bile also will coat and encase bacteria and parasite, which is why you have gallstones. So isn't that a happy thought? You want to make sure that your gallbladder lasts your whole life, right? And if you already had your gallbladder removed, we've got great products here that will simulate a gallbladder. It will emulsify the fats that you eat, and you really don't want to be without that. I've got a colleague that calls it gallbladder in a bottle, and it will really just help with your digestion. For those of us who still have our gallbladder, we want to make sure that we keep it in really, really good functioning order. As we get older, because of parasites, bacteria, and that kind of thing, the bile can become very sludgy. It can become very thick. And so the gallbladder will get congested. So we want to make sure that we do gallbladder flushes. We do liver flushes. I do that every year. And no, I do not do the olive oil and apple juice flush. I do not do that. I think that's very harsh on the body. There are easier ways, and you can accomplish a lot more with a lot less. So we want to make sure that gallbladder congestion is alleviated. If you have any kind of irritable bowel syndrome, it is probably because you have leaky gut syndrome, which means, as we talked about last week, the junctures of your small intestine are open. It allows food particles to go through there. It allows fungus to go through there, and that eats away of that mucosal lining, which allows bugs to get into your large intestine, which can irritate you, which can cause colitis, irritable bowel syndrome, and all that kind of thing. So if you have any of those symptoms, you want to make sure that we do gut repair, because without doing gut repair, nothing else is going to be repaired. All right. Google the ripple effect. We've got photos out there. If you need us to send you a photo, we can do that. And thank you, Transformation Enzyme Corporation, for providing that great visual. We use it all the time here in the clinic. So blood sugar imbalances. Now, you would not believe the number of people that come into the clinic that have blood sugar issues, either hyper, which is diabetic, type 1, type 2, or hypo, which is hypoglycemia. And so blood sugar issues are a real thing. And why is that? Because so much of our food is being flavored and sweetened with sweeteners that are synthetic, and our body doesn't know what to do with them. Our body doesn't know how to handle them. And so it sets off a whole bunch of problems with our blood sugar. Many people come in, and when we ask them what they eat, we ask them what they have for breakfast. They say that they have a pastry, or they have toast, or they have biscuits. They have carbohydrates, pancakes, waffles, that kind of thing. They have carbohydrates for breakfast, which gives you an immediate sugar spike, and then your sugar is unstable all day long. What we want you to do is we want you to start your day with a good protein. That can be an egg, that can be sausage, that can be bacon, that can be a steak, that can be chicken, that can be anything that is protein. Cheese is protein. And so you want to start your day off with protein, because protein takes a little bit longer to get into the system, and it keeps your blood sugar stable throughout the day. So you want to look at that. Hormonal imbalances are another thing that drives Hashimoto's disease. Polycystic ovary syndrome, you might know that as PCOS, causes hair loss, facial hair for ladies, facial hair, infertility, and menstrual difficulties. It also inflames the brain, which can trigger autoimmune flare-ups. Estrogen deficiency during perimenopause and menopause can also be inflammatory. So we don't want that, and we want to watch for that. If you have had your ovaries and your uterus removed, you definitely want to get on hormone replacement therapy. Of course, we want you to do the bioidentical, because bioidentical is cardioprotective, whereas synthetic is detrimental to your heart. So we know from our medical friends that 95% of cardiovascular events that occur in women who are postmenopausal. So using your bioidentical hormone balancing substances, now that can be herbs, that can be some foods, right? It can also mean bioidentical supplements. So you want to look those out. Yes, they are expensive. Yes, your insurance does not cover it, but you are worth it. All right. I am postmenopausal, just in case y'all didn't know that. Postmenopausal. And I found out about this, and I was not doing any kind of hormone balancing therapy. Didn't feel like I needed. I wasn't having any symptoms. But because I learned that going without estrogen is detrimental to my heart, I want my heart to last as long as I do. I want to last. I'm going to last as long as my heart does. So I started supplementing every day with an adaptogenic herbal blend that balances out my estrogen and my progesterone. So that's something that everybody needs to think about if you're postmenopausal. And then we've got the lovely environmental and chemical toxins. If you're on medications, you need to know that most of your medications are made from petroleum products. you are never intended to eat petroleum. So when you are taking medications that have petroleum in there, then you are setting yourself up for a toxic overload, which will what? It will confuse your immune system and it will trigger autoimmunity. Chemical sensitivities can be to BPA and plastics. I think that's bisphenol A in plastics. A lot of the times you will see, in fact, at church, they give us water at church in the water bottles. And I have been noticing on quite a few of the brands, even brands that I do not buy, I go for spring water. Sometimes we have spring water, sometimes we don't. Sometimes the water says it's purified water, but it's also gone through reverse osmosis, which is a good thing to do. But almost always on the label, it will say BPA free. Why do we want to be BPA free? Because BPA affects your hormones. There are a lot of xenoestrogens in that are synthetic estrogens. There are synthetic estrogens in soy products. So we never recommend that to our female customers. We just don't, because everybody has a thyroid. Men, you do as well. But women also have a lot more estrogen in our system because of the fact that we are women. So we definitely don't want our women doing soy products. And our men, if you do soy, we want you to make sure that it is not genetically modified. All right. Remember, we talked last week that every cell in the body depends on thyroid hormones to function, and the brain's neurons are no exception. So these are some ways that you can support your thyroid support your brain if you have thyroid dysfunction. The best way to improve thyroid brain is to manage your autoimmune situations. A full program is beyond the scope of this article, all right? But there is an online guide. So we're going to post in the comments this online guide, so you'll be able to follow that. So you want to follow an autoimmune diet and lifestyle. That means 4 to 6 weeks, right? 4 to 6 weeks that consists solely of meats, lots of vegetables, healthy fats, minimal fruit due to the high sugar content. Then you want to reintroduce the foods that you eliminated one at a time, one every 3 days, to see which one causes a reaction. Now, this is called an elimination diet. I don't really particularly like elimination diets, but for this purpose, this is very good because it's going to show you which foods you have a sensitivity to. Now, I'm not one that wants to give up foods that I love. I don't want to do that. What I want to do is heal my gut so that I can eat the foods that I love. And I love mostly good foods, but I will just tell you, when I'm going through a stressful situation, I do like my mac and cheese. I do make it organically. I do make it from scratch, but still there's just not a whole lot of nutrients in that. Even though it feels good and it tastes good and I do like it, I only indulge maybe once every 4 to 6 months. So that's not very much at all. You want to make sure that you don't give up your comfort foods, but you don't want to have them every day. If you want to skip the diet and test for food sensitivities, the author recommends Cyrex Lab Array of 10 multiple food immune reactivity screen. You can do that. I guess you can ask that from your doctor. You might want to Google that. I'll tell you again. It's called Cyrex Lab Array 10 multiple food immune reactivity screen. All right, you can do that. We do test here in the clinic for food allergies. If we do that, well, we don't do that on a first visit, because on a first visit, you're going to be allergic to everything. Why is that? Because most people present with gut issues. Gut issues are the number one thing that we see. Autoimmune issues are the number one things that we see. So we want to make sure that we get the gut repair done first. And then once the gut is repaired, then we're going to go in and we're going to check for sensitivities, and then we're going to work on those things. Glutathione. Glutathione is a supplement, and the supplement is a heavy metal remover. Now, why is that? Because genetically modified foods always have heavy metal toxicity in there. Chemicals can have heavy metal toxicity. Where we live in the Houston area, We've got Baytown in Pasadena, which have all the plants in there, and they're throwing off noxious gases all the time. So if you work in that area or live in that area or drive through that area, you're getting that on your person, in your skin, in your lungs. And so those are some of the things that we want to do, that we want to get rid of those toxicities. And so we know that supplementation dampens inflammation and supports the brain. Glutathione is one that most people need because most people are deficient in that. Aging also deprives us of glutathione. So if you take glutathione regularly, you are participating in an anti-aging program. How about that? Resveratrol and turmeric also will help you with your stomach issues, and it will help you with your inflammation. It just depends on how bad your inflammation is. Now, I will just tell you, turmeric is not readily absorbed by the body. It's not readily available. So when you go to your big box store and you buy the very inexpensive turmeric, it's not going to benefit you at all because it's not bioavailable. And so what you want to do is you want to get a really good brand. There are only two that I know of that are bioavailable. One is the curcumin brand that is 9 times more bioavailable. And the other one is Physica Energetics brand that is 20 times more bioavailable. So guess which turmeric I take? I take the Physica one because it's 20 times more bioavailable. The curcuminoids, they are good for inflammation. They're also good for pain. And so you want to make sure that you take advantage of that as well. Sufficient vitamin D dampens inflammation and supports brain health. Therapeutic doses of the cholecalciferol form of the vitamin, okay, you need to be taking, this article says 30 to 35 IUs a day. Now, why is that? Well, that is because most people are deficient in vitamin D. You want to, on your blood work, you want to have your vitamin D3 level at 60 nanograms per deciliter or better. Most people come in and they are at 30 or even below 30. Your medical reference range says that 30 is enough, but I'm here to tell you that we don't believe that. We believe that you need a lot more than that. And the darker your skin tone, the more vitamin D you need. Why is that? Because for some reason, you're not manufacturing vitamin D from your sunlight. So we want to make sure that you get what you need. I've only ever seen one person whose vitamin D level was over 100. And that was like amazing. We rarely see anybody that's over 60. Sometimes we do, but very rarely. You want to make sure that you do high intensity interval training. Why is that? Because that training, that working out, that moving of the muscles and the bones, it reduces the inflammatory response. So you want to be able to do that and make sure that you are good. You also want to practice mindfulness and meditation to dampen the immune response. And so your body is going to respond to whatever you tell it. If you tell it to be calm, if you tell it to be at peace, if you speak against the inflammation and all that kind of thing, and you do mindfulness practices, you're going to cause your body just to settle down and to be more healthy. The doctor goes on and says, a good brain health program goes beyond optimal chemical environment. Like a muscle, the brain must stay exercised to stay fit. One of the simplest, easiest, and most effective way to exercise your brain is through daily meditations. Just 10 minutes a day of meditation can improve the concentration of your working memory, the ability to keep information active in your mind. Meditation is especially important if you're suffering from brain-based symptoms common in Hashimoto's hypothyroid patients, such as depression, poor focus, constipation, anxiety, and chronic pain. Meditation is so I can't talk right now, I'm sorry. Meditation is so effective, it actually changes the shape of the brain for the better. So I don't really care what kind of meditation you do. I do biblical affirmations. I do biblical prayer because that's what I believe is going to be best for me. But the studies show that any kind of meditation is going to work. It exercises the brain. It calms down the brain. It puts you in a good place, and it can even change the shape of your brain. So that's a cool thing. Just 2 months of daily meditation increases the thickness of the hippocampus, which is the center of learning and memory. Meditation decreases the volume of the amygdala, the brain's center for fear, anxiety, and stress. Subjects report feeling less stressed as well. Meditation also supports the autoimmune management by dampening inflammation and helping to regulate the immune system. In a 1998 study, it compared the healing rates of patients undergoing UV light therapy for psoriasis, an autoimmune disease, and it compared it to others who were not. The subjects were meditating while the light box experience cleared the skin 4 times better than those who did not meditate while doing the treatment. So when you meditate, you increase your healing potential by 4 times. That's really, really important. So I would just say you want to do that. Now I want to go back to the hippocampus. The hippocampus is in your brain. It resonates at the same frequency as the Schumann wave. Now, don't want to get too kooky out there, but Google the Schumann wave. That is the balanced wave in the atmosphere. And so if your hippocampus is resonating at the same frequency as a Schumann wave, then you're going to be much, much healthier. And that's what we want. Okay. So in conclusion, we want you to know that autoimmunity affects your brain and affects your brain health. When you come in here to the clinic, we always do a baseline test, and the baseline test will tell you if you have an inflammatory process going on. Now, if you have chronic pain, you have an inflammatory process going on. If you have chronic immunity issues, autoimmune disease, diabetes, PCOS, Hashimoto's, fibromyalgia, chronic fatigue syndrome, all of those kind of things, you are in a chronic state of inflammation. When you are in a chronic state of inflammation, then you are not going to be able to heal. When you are able to get that under control, then your body is going to sync up and you're going to have a really, really good response to any supplements, any diet, anything like that. So what do I want you to take away from this? I want you to take away that managing your thyroid system right here, your thyroid is here, has a direct implication on your brain. So you might not know that your thyroid is out because your medical doctor says that your thyroid levels are all fine. But if you have those other symptoms we talked about, then you possibly are not where you need to be. And it would do you some good to think about an anti-inflammatory diet, think about meditation, think about proper supplementation. It's about all the time we have today. So thank you for joining me. As always, I appreciate you. I appreciate the time. I appreciate the shares. I appreciate the smiley faces, the love faces. Don't appreciate the angry faces too much. So don't give me any of those. And I will see you next week. Take care. Bye-bye.